Okay, good evening all. Thanks, Dr. Chaitra and Dr. Rohit for this opportunity. So, my topic for presentation for today is cost is not an issue when it costs just a pittance. So, we come to it. No financial disclosures as I have not earned much out of it, or I would say nothing. Just to give a background that this was a time when the lockdown was there. Yes, this is when it started 23rd of March. Usually our OPD is pretty busy. In 2019, yes, as we can see, the OPD is really busy. But in 2020, because of the lockdown and the after effects, it was nearly empty. And why this preclude is because of this, that the need of the question was, there was a case-based examination or a DNB practical examination which had to be conducted at our center. So the questions were how to manage it. Do we give them charts like this for retina and then show it to them what it is? Do we give them slides and show it to them, or do we give them printouts? All these issues was that at that point of time the fear was so much that because everyone wanted to be safe as possible, not come to maintaining distance at least 6 meters or 3 meters at least, not touching objects. So how to give them that kind of a safe environment so that they can show their skill of examination and still we can evaluate them. So then came this answer in our mind that it can be a safe eye examination, which is C. How did we go about it? So no personal interest in this. We utilize this reti. We thought whether, because this already has some kind of a template inside, can that be used for an examination? So what we thought is whether we can replicate the same kind of a image what we have of a fundus photo having a pathological images over there, but usually not. So whatever was recreated was not as well, because as we know, what we expect is not always we get. We thought it's probably because of the dark colors, but the problem was even the lighter colors were much worse, like yellow, orange, white. Those were not seen much well because the template itself was having some orange color. So we thought, why not to put a photograph inside? So we identified the diameter of this bowl, which was 30 mm, so around 3 centimeters. So we marked this was the first printout. As we can see, it's of a very poor quality. We cut the edges, but when we put this inside, there was a lot of folds. So what we thought was, let's try some better printing. So we tried on better printing like gloss paper, matte paper, butter paper, more better GSM 125 quality, and various papers were evaluated on this image scale by at least 2 consultants and 2 fellows to understand which is working well. Then we identified that the matte is working well, and that's how we started with it. That, as we can see over here, that the images are made in a circle of 30 mm, and those are cut, and the edges have to be really cut in a round shape, and there needs to be having a small crescent at the edge which has cuts on the four sides so that it can go into the convexity of that mall, as we can see. So once we remove the anterior flap, and we can see that it sits very well inside, and then we can put on the front part of the assembly, and then we can use it as an examination technique. So as we can see whether it is effective, that's what we can see in this video, that doing an indirect ophthalmoscopy, we can see the very well the areas of pathological problems in the eye. We can identify the signs. Symptoms may not be there, but yes, at least the signs can be elicited, and then examination technique can be evaluated in indirect ophthalmoscopy. Can this be utilized in a slit lamp per se? As we can see, yes, in the slit lamp evaluation also. This is a diabetic patient where we can see hard exudates, soft exudates. And yes, in the periphery also, we can see if we increase the illumination. So it was effective in, yes, the slit lamp biomicroscopy. Whether it is effective in teaching lasers, yes, as we can see, the laser spot is very well seen over here. And once we shoot the laser, we can see there are some changes because the laser also, we can see some kind of a pigment falling from here. That is again a very good sign that the laser is taking up over there. And that is how it can be done. So we evaluated it, that whether it actually works. So 53 responses were accounted for. In that, as we can see, more than 90% of responses had very good or either no pixelation or no artifacts, and very good sharpness and contrast, as we are seeing, and good diagnostic efficacy of more than 90%. And yes, we utilized this for the same evaluation for our DNB exams, and it worked very well. And to compare with other techniques which are available, the diabetic retinopathy technique, which is only for direct, we can use it for indirect also. The disadvantage in this case is it is only for a stimulation, but in our case, there can be a live demonstration. The other stimulative videos which are available, this can be done only for a direct ophthalmoscope. We can use for direct, indirect, 90D, laser. Yes, cost is nothing at all, just the printable cost. Finally, the most important is the 3D visualization, as the most important VR magic which is available. As we can see, but the laser can still not be learned in this, and only indirect is possible. Slit line biomicroscopy is still not possible. Yes, we are trying to publish it, and it is already accepted for the publication. Thank you, and I would like to thank all my credits to my team. Thank you again.
Thank you, Divyansh. Dr. Vaishali and Dr. Vishal, I think both of you are the most competent to ask a few questions and see how relevant this has been to all of us.
No, I think it's a great thing to do. I'm really, really impressed, Divyansh. Because what we actually have been doing is the projections using and VR magic and all, but still we are not able to do indirect. And looking at you, I thought we could simply start using it for.
Thank you, man. Thank you.
Virtual exams. Wonderful, wonderful.
So Divyansh, I think the next step is to make it commercially available or whatever you want. Even if I mean, there is no harm in saying that you have a financial interest. You may work on a no profit, no loss basis, but still making it available costs some money.
Sir, it's just a printing cost and nothing else.
Yeah, but you see, when you're doing it on a large scale, it's a lot easier when one station does it.
Sure, sir. We would consider that. I would discuss it, sir.
Yeah, you can make it available.
Sure, sir. Thank you.
And please gift it to PGI.
Thank you, man. Yeah, sure.
Why only to PGI, madam? Even to us also.
For everyone.
You have enough resources. You don't need it. Yeah.
Whoever have attended this session, you have to give it free, Divyansh.
Sure.
Yeah.
So one more advantage of this is we can actually show the rare images like retinoblastoma, tumors, ROPs also. And for lasers, we can utilize this for lasers, identifying whether they are doing correct lasers, whether they are. And the only disadvantage is that the wide field. So we are right now working on that, where we are montaging, because we do not have a wide field camera with us. So montage images we are working so that we can have a wider field of view and the examination can be taken in other cases also.
I'll have a suggestion over here, Divyansh, because the thing that you lose out on a flat print is the 3D, the depth perception, because the candidate is doing an indirect during his post-graduation, and when he comes for the examination, he gets a flat image. So next, you probably take this next level and try 3D printing with 3D images. You show a raised retinoblastoma over there.
Understood, sir.
It would be real. It would come as close to the real one as possible.
Sure, sir. Point well taken. Sure, sir.
Correct.